advice that I'd give another supply chain leader in other organizations or somebody who is starting out in healthcare is be engaged. When you look at all of the aspects of healthcare, supply chain is I'm very knowledgeable about supply chain. I've been in the supply chain world my entire career. And there are just so many webs that are associated with supply chain. Supply chain, one of the few support services that are engaged in everything. And supply chain is just so ingrained in everything healthcare related. So you have to be engaged. You have to understand that everything you do has an impact somehow, some way to the patient care. And it's very easy to be disengaged. It's very easy to step back and say, you know what, I'm just delivering boxes. I'm just delivering supplies. I'm just couriering this product, or I'm just working on this contract. I'm not doing patient care. And they're right, they're not doing clinical work. They're not at the bedside. But the clinicians can't do what they need to do if they don't have those supplies. The clinicians can't do the work they need to do if they don't have that equipment.
I think the biggest one, so we did go live on a new ERP system this year. I think, again, going back to that, the cost structure of healthcare and how do we keep cost out and remove costs that are already here, is how do you do more with less? How do you continue to advance your technology and without having to increase your staff? How do you, we're fortunate here that we've grown leaps and bounds and continue to grow. There's not a lot of hospitals out there that are growing without adding staff, because we've been able to supplement that staff with technology.
Some advice that I would give to other supply chain leaders in the healthcare organizations is be open to technology, outside of the box thinking. It can go a long way.
Honestly, I think we're here for one reason, and that's to provide a good outcome for a patient, someone that has a need. They're here, they're scared, they're not sure of what's taking place, and we tend to think of things as supplies or dollars or things like this, but we have one reason to be here, and that's to help a patient get out the door successfully. And I think you have to make that connection with all the staff and the support functions that we're here for the patients, and everything we do impacts a patient. If we had no supplies, patient care would be pretty rough. And so the job is very important in supply chain, and we need to keep it patient-centered, and that's my advice.
I try to give the same words of enlightenment to my team, is be engaged, because what you do may not seem like it has an impact, but it can have a significant impact on patient care.